Let's talk about the social model of care versus the medical model of care. Social model of care focuses on choices, activities, desires, ability, removing barriers that keep a person restricted. When any of us would find a way to do what we want to do and find a way to do it. The social model of care seeks to provide autonomy to the greatest level of each person's ability. Autonomy is what we practice every day for ourselves when we make choices as to allocating our time, when we want to eat, when we want to shower, take a break, talk to a friend, or so on. The social model argues that disability is primarily caused by societal attitudes that cause barriers such as discriminatory practices. How about ageism? Do we ever just assume this current issue is only occurring due to age? I want to tell you a story about one of my residents. His name was Charles, and Charles was a delightful man. He was just, people loved him. One day just started cursing people out and shaking his fist and biting his hand, and people just assumed that maybe this had to do with age. So he was being treated to learn how to be calm, to settle down, to be redirected, to have a seat, to have some tea, and so on. One day he goes to his dentist, and the dentist asks, "How has Charles been lately?" And the staff says, "Oh, he's been okay, but, he's aging a little bit, so, there are those things to consider." And the doctor says, "Well, come on to the back, I want to show you something." The doctor pulls down Charles's gum and shows a huge abscess on his gum. It's an infection due to a partial that he had. So Charles wore a partial in the front part of his teeth,